Hello, everyone, whether it's morning or evening, wherever you are, because the thing is that in this discussion, I'm from Pakistan and my guest is from the Texas. So that's why I said good morning or good evening, wherever you are. So thank you so much, everybody, for joining me. My name is Dr. Ina Khan. I'm a clinical psychologist, psychotherapist, and speech therapist, and I'm working with children and adults. And as you all know, that I am doing this session for creating mental health awareness and we are discussing different topics. So today topic is about those mothers who have stress and the level of it's not just about that they can work or they can have access to good mental health care, because if they're earning, then they can go to some good place and they can get some therapy. But there are a lot of other factors which is contributing in their stress as well. So today my guest is Kate, and she is okay. She, according to her, that my passion is support working women, moms, and help them manage their stress and stressor. I have a master degree in family sciences and also training in stress management, mindfulness, and parenting. And today the topic of our discussion is stress management in working mom. Thank you so much, Kate, for joining me today. Can you hear me?
Yes, thank you for having me.
Okay, so I would like you to give your more detail, and then we'll start discussion about the topic which we selected for today's discussion.
Yes, so I'm really passionate about helping other working moms like myself manage their stress successfully and learn how to thrive in their lives and their relationships. And so a lot of working moms really find it hard to really have time for themselves and to really focus on how they can manage their stress successfully, because it's so easy to get caught up in the day-to-day busyness of life that it's easy to neglect ourselves and our own needs. So I help moms really develop an empowering mindset, first of all, about stress, and then second of all, that they have the ability to either access resources or rely on other people and their support networks in order to manage all their stressors successfully.
So it's basically you're running a support group as well. So it's not just about you helping them, you're actually empowering them as well. Am I right?
Yes, that's right. Yes, because support group is really important. It can feel very isolating when you're stressed out and burnt out because of work or family life. And so realizing that other people are facing the same stressors as you or similar ones and can relate can really help you also to manage your stress.
So when we talk about stress, it's not basically, it could be, the symptoms of somehow depression, anxiety. So, and I'm sure a lot of people, when they came to you, they don't know how to talk about their feelings, whether it is a stress or it is just an underlying cause of something. Because if a person came to you and they're just because of they're unemployed, so it means that their stress is because of unemployment. Am I right?
Yes, right.
Okay, so and I think the problem came when the person start having the same level of stress, the anxiety and the depression and things like that. That the person is not able to sleep, that person not able to take care of himself and his family member as well. When the stress stays over there. So, do you agree to this point, or you have some other you could say other opinion about that aspect? Because stress is maybe a small symptom of a big thing. So how you're going to counsel these mother and parents that they should start talking about their feelings, and what is the difference between the high functioning stress or low functioning stress? How you talk to them about these things?
Yes, you bring up a really good point. It could be a symptom of deeper issues such as anxiety or depression. And so I am very careful in how I help my clients and support them. And if I see something that could be a diagnosable issue, then I do recommend that they seek the support of a therapist or a psychologist. And so it can become a partnership where if they get permission from their therapist to work with me, then they can do both therapy and coaching. So they get the help treating that mental health diagnosis, but then they also get help from me as a coach in recognizing where they want to go in their lives and what goals they can set what action plans they can create in order to move towards those goals.
So over here, I would like to ask you one question that maybe a lot of people are not that much familiar about the coaching and the counseling. I mean, these are somehow different things, but what is coaching actually? And I would like you to tell me, because people should know the difference between when they need to go to a coach, when they need to go to the counseling, and when they need to go to seek the therapy. So please tell us, what is coaching actually?
Oh, that is a great thing to talk about. So coaching is distinct from therapy, although there is some overlap, definitely. What we say is that typically therapy focuses on the past and the present. So they're focused on trauma or issues that are holding you back from past events. Also, they are responsible for diagnosing mental health issues and helping people to be able to live and thrive in the present. And there is some future work in some therapy, but coaches are there to support people in figuring out and self-discovery. So discovering for themselves the wisdom that they have within already, and also arming them with tools and resources to help them to overcome what's holding them back right now to thrive. But also, like I said, setting goals and action plans to be able to move forward and really thrive and move towards whatever they feel is the ideal life for them.
Okay, so it's a thank you so much for explaining us very in detail that how coaching is actually, and what I'm getting from, because okay, I would also like to tell me something about mindfulness, because a lot of people are talking about mindfulness, that you should have a life with mindfulness life. Okay, we are saying, but why we are not telling other people what is actually meaning of mindfulness? And that's the reason why I'm doing these discussions, so that people start understanding what are different things, where they need to go, and if they cannot go to the therapist, maybe they can go to the current issue which they are facing. There are some underlying issues which I'm sure a therapist could deal, but there are some issues which a person could deal at hand. For example, you're talking about the stress. So I would also like you to comment on mindfulness as well. What is mindfulness actually?
Mindfulness is really an amazing tool. It is basically, the idea is that you have an awareness and acceptance of the present moment. And that also includes an awareness and acceptance of yourself and who you are, as well as all those around you. And so instead of worrying about the future or thinking about the past and feeling bad about the past, you let go of all that mind chatter and just focus on the present. And really, that's one of the most effective tools for stress management and emotion management, is being able to really take control of your mind and your thoughts.
Okay, how are you going to practice this mindfulness? Before that, can you tell me that are you practicing mindfulness with your clients, or the people or the mother you're working with, or you are just, you have some other techniques for your work?
Yes, I definitely practice mindfulness with my clients. In my group coaching, I like to start with a mindfulness moment and just teach them a simple mindfulness tool that they can use. It might just take a minute or two. And it's something mindfulness practice throughout the day. But I also like to tell my clients to have a morning time, where I like to call it my morning power hour, where you set aside some time for mindfulness. It doesn't have to take a whole hour, but as part of your morning power hour, maybe just 10 minutes of just sitting mindfully. I have a lot of audios that I also share with my clients. But the most basic one is just a breath awareness exercise, where you just focus on your breath and just imagine the breath coming in and out of your nostrils and flowing through your body, cleansing your body, and then breathing out all the negativity that you have. And so there are really lots of ways to practice mindfulness, but that's really the most basic. Another one that I love using, and I do this almost every day, is when I go in the car and go somewhere and I'm by myself, I do mindfulness driving. And that's where you just focus on the driving, and you're focused on, oh, what does the car in front of me look like? What signs am I passing? What's going on all around me? What do I see? What do I hear? What do I notice? And so these are just very simple ways to practice mindfulness. And a lot of people say, oh, I can't do that. It's just too hard. You know, my mind goes here and there. And I think most of us have that happen. But what's key is those moments, those magical moments of awareness when you realize, oh, I got distracted. I'm not thinking about the present moment right now. Let me let go of whatever thoughts distracted me and get back to what I'm supposed to be focused on. So if you think of it as like if you're doing reps, you know, if you're trying to strengthen your muscles, then that magical moment of awareness could be seen as a rep, of a mindfulness rep. And each time you do that, it gets a little bit stronger and stronger. And there have actually been studies that show that your prefrontal cortex actually strengthens, and that's the part of your brain that's responsible for emotion management. It actually strengthens with mindfulness, and the limbic system area that's more responsible for the fight, flight, freeze response, it actually lessens in strength. So it's really incredible the power that mindfulness can have on your mind.
And secondly, limbic system is also involved for, emotional responses, the way you're giving response to the emotions. And how emotional you are with certain condition. For example, there's some stressor, and how you're emotionally going to react that. And your daily life, how your emotions are driven, your decisions are driven by emotions or not. Okay. I also like to one question, whether mindfulness is same yoga or yoga is a part of mindfulness.
Yes, yoga can definitely be a form of mindfulness. I personally don't practice yoga. When I've tried it hurts my head. It just doesn't work well for me, but other people just love it. And it can definitely be considered a form of mindfulness. Even when you go walking, that can be a form of mindfulness. It's anything that you do can be a form of mindfulness as long as you're paying attention to what you're actually doing in the present.
Okay, so it's mean that any activity, or you could say that when you're talking about mindfulness, because it's important past, because over here, these are actually, you could say, these are the way you're teaching your clients how to take care of themselves while they have stress. Am I right?
Yes, definitely.
Okay. So I would like to ask you one thing more. That, okay, let me tell you something. When we are working with you, those clients who have
and then don't know how to connect their body. And when you have anxiety, you might have also seen a lot of patients and a lot of clients that they don't have control over their body, and they lack the control, and secondly, their body and their mind is not connected. So sometimes they say that a certain part of body is hurting, but actually it is not hurting. And there's a lot of patients before coming to me for the therapy, they go to ECG and other medical tests which are all clear. So that's the message of their body, that's something wrong, and they're not able to read that message. So I would, when we will conclude this session, I would also like to ask about this as well, that how you can read the message that is coming from your body. Because I think when you talk about mindfulness, then definitely you're somehow understanding how to listen to your body, because that is part of yourself. So as you mentioned over that about mindfulness, and that you're teaching other people or your student or your client about mindfulness. So basically any activity in which you are able to clear your mind. It could be breathing as well. Am I right? That could be in the mindfulness. Any simple activity.
Yes, and actually there are several forms. So it could be an awareness of your surroundings, but also like what you were saying about being aware of your body. There are definitely exercises for body awareness. I'm sure you're familiar with the body progressive muscle relaxation exercise. That's a form of mindfulness.
I was also asking a question about it after that question, and so I would please explain us more, so that there are a lot of things when you cannot. A lot of time you cannot go to some therapist because you can get panic attack at any time. You might be familiar of this situation as well, because I'm sure when patients come to you, they share their experiences, and you can have panic attack at any time. It could be while driving, it could be while going to school, while presentation. So I'm sure if they understand the mindfulness, they understand how to take care of their self, how to identify the stress and stuff like that, so that they can manage themselves somehow at that point. And definitely they will need some therapist or some coach help to uh, deal with their situation effectively. But even then, if we tell something about to the client or to the people who are listening to us, so that they get some idea that what could be the other form of mindfulness.
That is also something that is very helpful, is to pay attention to what your thoughts are. So a form of mindfulness could be just mindfully visualizing what your thoughts are and what your emotions are, accepting them, being curious about them, not judging them. So I do have a client who struggles with anxiety, and something that I've taught her has really helped with her stress. And I call it the Sally stress system. So my clients like to visualize stress, the emotion of stress, as this cave woman, Sally. And so this is a form of mindfulness where they're aware when she comes in, because when she comes in, they have this feeling of tension. Their heart might start racing, their muscles tense up. They might start sweating, all of these body signals. So think about how that is a form of mindfulness, right? Paying attention to what your body signals are. So they recognize that. They say, oh, there's Sally, here she comes. She's coming to try to protect me because she thinks I'm in danger. And just that awareness and acceptance that she's there to protect them actually helps to empower them and to take charge of that stress. And so this client of mine that has struggled with anxiety has been able to let the stress go much more easily because she's in charge, not the stress. And then, she uses a breathing technique or some other coping tool to be able to tell Sally, I'm safe, I don't need help right now, and to just let her go. And so that is a very simple kind of mindfulness technique that you can use anytime you start feeling stressed.
Thank you so much. That was a very good, techniques. And sometimes when you're a therapist or you're a coach or you're a counselor, then you need to be creative as well, because a lot of people are coming to us from different backgrounds, so their story is different. So we have to modify our techniques according to which is better for them. That's why we were in therapy where you were using eclectic approach. Because if you say that I'm just doing CBT, I'm just doing behavior therapy, I'm just doing gestalt therapy, so every case does not fit to that criteria. So you cannot work on that thing. Okay, before going to the techniques about stressor and stress management techniques, or identifying the stress, I would like to ask a question from you that, okay, we are talking about a lot of time giving to yourself, just go outside and go some mindful driving, or you use tell about in the morning, just take out some time and focus on your breathe or focus on your thinking. It requires some time. What about those mothers who are working mothers? So how you're going to deal these clients, and how you're going, or how you're making them to take time from themselves, because it's the challenge. Why they came to you? Because they're in stress. And why they're in stress, they cannot manage their time, they cannot give time to their family, they cannot give time to their children, and even they're neglecting their own self as well. So how they're going to make time for themselves?
Oh, that's a great question. Yes, that's probably one of the top issues that working moms face. And so one of the first modules in my program is about time management. Because if you can't manage your time, none of these other things will work, because you're not going to be able to fit in any time for these self-care or mindfulness activities. And so I like to use the pickle jar theory, where everybody has the same size of jar. So imagine that the amount that you could fit in the jar is the amount of time that you have every day. So everybody has 24 hours in a day, right? And it's really up to you. So time management is really self-management. It's really up to you how you fill that time, how you fill your jar. And so we use the analogy of the rocks, the pebbles, and the sand. So if you just try to put the less important things, the pebbles and the sand, in first, then you're not going to have room for the rocks or the really big priorities. So that would be your family, right? Your family responsibilities, taking care of your kids, your work responsibilities. So those major things that really need to get done. But if you do it the other way, where you put the rocks in first, then you have more room for the pebbles and then the sand. And so it's really a matter of figuring out what your priorities are every day and making sure that you put in your schedule. It's called time boxing, where you actually put it in your schedule, those priorities that have to get done that day. And I would say, I try to tell mothers, like, the self-care activities, think of what is important, that, make that a priority, make that one of your rocks. Because if you're not functioning well, if you're not healthy, then you won't be able to get anything else done. You won't be able to take care of your family or your work. And so I think it's a matter of just mind shifting, realizing that, yes, this is important. This is important for my family, for myself, and for my future. And really also deciding what's not as important, being able to either let things go or put them off for another day. But really it's about figuring out what you have time for and what you really need to prioritize in your daily life.
So what I think is, if a mother is coming to you, then she already on the edge of everything, and she's very tired, and she have tried everything, and she's physically exhausted, she's emotionally exhausted. So that is the level when she came to you. And definitely, if somebody come to you, then they are ready to make these efforts. And if they are not, I'm sure you cannot help these people, because I asked a question from a therapist in my last conversation, and I asked, and a lot of parents are asking that question from me: if a person is not willing to take the therapy, how are you going to do that? How are you going to help them? And she said, you cannot help these people. Maybe the family try to do some indirect way and ask them. But if a person is not coming to you, the person is not willing, then you cannot help these people out. So what is your opinion about that thing? That if people are not trying to, understanding, or they are not getting the idea that there's something wrong with them. Because people come to you or come to us when everything is, at the edge. When their whole life is, messed up. Their relationships are messed up. Their personal life is messed up. Their occupation is messed up. Even their education is messed up as well. So maybe if you start these talk like on regular basis, maybe they have some idea to take out any problem from the start. So what are you going to tell those people who don't want to come to you, or who are not willing to understand that, or who cannot understand? It's not about the willingness. If you cannot understand that, who don't have sufficient, you could say, peace of mind, that they don't understand that they're facing some kind of stress, and stress could lead to burnout as well.
Yeah, you're right that we do have, we're all involved with people who are kind of at their breaking point, right? They're burnt out and overwhelmed and exhausted. And I think a lot of people at that point are willing to make changes because they see how it is affecting their lives, their relationships, and their health. But I do think that's true, that if they aren't willing to make changes, then, kind of our hands are tied, right? We can't force people to change. But what I try to teach my clients is it really doesn't take a lot of time. You can do things while you're working on your priorities, your responsibilities. You can practice mindfulness while you're driving to work, right? You can practice mindfulness while you're eating. The modules that I give my clients are really fast and simple to do on an app because I know that they're busy. But I like to teach the 1% principle that's from Atomic Habits, where, if you work on yourself and try to just improve yourself by 1% in just little areas every day, then by the end of the year, you'll be 30 times better than you were at the beginning. And so it doesn't take a lot, of time, just some effort and some planning to be able to make these small changes.
And when we talk about the stress and we talk about these things, and even we talk about working mothers, so they have a lot of things on their head. It's not just about the responsibility. They're taking burden of the family. They're taking burden of the children. They're taking burden of the husband as well. So, for example, if a mother come to you and she tell you her story that I'm not able to give time to my parents, not able to give time to my family. My children are crying all the time. I don't know what to do with them. I have trouble with my husband as well. I have problem in my office as well. So how you are going to help that working woman, that mother, to identify the stress identify the stressors in her life?
That's a great question. When we coach, I use a lot of discovery questions
Okay.
to really help her to think about what the underlying issues are. Because a lot of times it's these surface things like, oh, I get stressed because I'm late, or I get stressed because I can't get dinner on the table. These things that are kind of, we think of as surface stressors. But a lot of times there is this underlying stress that really is affecting everything else. And a lot of times it is a relationship issue, or even deeper, it's a self-esteem issue. And so as I talk with the client, as she opens up to me, she usually has some kind of breakthrough where she realizes, oh, it's not about the meal planning. It's not about being late. It's this underlying issue that is surfaced by these other stressors. And so once she uncovers that, then we can actually tackle, okay, how are we going to address this underlying stressor? And a lot of times, like if it's a self-esteem issue, you know, we go to affirmations and we go to mantras of things that can help change those beliefs that she might have of who she is and what she's capable of, so that she can really feel empowered. If it's a relationship issue, you know, then we talk about what tools she can use to improve her relationship. And so it really, like what you said earlier, everybody's different. Everybody's coming from a different place and everybody has different issues.
Yes.
But once we can uncover what the underlying root issue is, then that's where real change can take place.
Okay, so what are the techniques which you tell them? Because we talk about mindfulness and you talk about Sally, I guess, as well. If I'm not wrong about that term, you said something like Sally, that she taking control of your own body. So what are the other techniques that a mother, you are teaching them to use to overcome the stress, and how they can manage their stress?
Yeah, so Sally is actually, it's an acronym as well as the name that I use. So the first step is to stop when you are aware that you feel that tension, or when you feel those body signals. Stop, take a deep breath. And then the A is accept her, accept that she's there to protect you and to keep you safe. And then the first L is to let her help. Let her help if you need that extra energy boost that she brings with her, or if you need some protection. And then the second L is let her go. Let her go because she can't stick around too long or she'll turn into burnout. And you'll drain all your energy. So you need to use coping tools that work for you. And one of my favorite ones that clients love is the square breathing technique. So I don't know if I'm sure you're familiar with it, but where they imagine the four sides of a square. And when they breathe in for 4 seconds, and then they hold their breath for 4 seconds while they're imagining that they're going around each side of the square. And then they breathe out for 4 seconds and then hold for 4 seconds. And so that's a very effective, quick coping tool that they can use to just tell her, I'm safe, I can let you go, or whatever coping tool works. You know, there are hundreds of coping tools that they could use. And then the Y is you time. So making sure that you're taking time for yourself several times a day, just like you eat several times a day. Your mind and your spirit, they need that nourishment. So you have to take time for yourself every day, several times a day, mindfulness, relaxation, you know, whatever it takes to get that energy back up. And so that's my Sally method.
Yes, and I really like the idea. S for stop, A for accept, L for let her feel safe, let her go.
Let her help.
Okay, let her help. And the other is let her go, and the Y is your time. Like first, basically, I really like this idea. And whenever you put these things into simpler form, that it's very easy for other people to understand that what you're going through and what you're going to work for that. And but and as we discussed earlier, that everybody's coming from different, and techniques could be different as well. So whatever works for them, and our job is to empower them to deal their stress effectively so that they don't reach to a level which we talk about burnout. Okay, first I would like to ask something about burnout, that what you do when somebody come to you and they're at a level of burnout. And second thing is that I would like you to give some, you could say, message to the viewer as well, that why it's very important to take mental health care, why it's important to talk about the emotional issues, why it's important to take help for their stress as well. So so that we should conclude our discussion as well.
Right. So burnout really happens when you feel that your resources are not able to keep up with the demands or challenges that you're facing. And so you just feel exhausted, you feel overwhelmed, you don't feel passionate about work or parenting anymore. You're just doing what you can to get by. And so first of all, you have to take time to rest, right? And that's what most people do, right? They take some time off of work, they just try to relax, sleep a lot, just recover. But a lot of times it can come back because we haven't addressed the underlying issues. You go back to work, go back to your regular life, and you get back in the same rat race feel, So not only do you need to take time to rest, to recover, and let go of the burnout, but you have to make changes in your life. And a lot of times it is from not setting healthy boundaries for yourself to protect yourself and your well-being. And so that's another part of my program that I teach my clients, is how to set healthy boundaries at work and at home so that they can protect themselves from burnout.
Okay,
and another question that you had asked was, why is it so important? And I think I love that there's more awareness, of the importance of taking care of our mental health, because it really does affect our physical health, and it affects every aspect of our lives, especially our relationships. And so I've noticed in my own life, when I can take better care of myself, then it actually impacts my children and how well I can parent. It impacts my marriage and how strong my marriage is, and it impacts my friendships. And so every aspect of our lives can be improved when we focus on improving our own mental health and really enjoying life, realizing why, what our purpose is here in this life, and what our mission is,
and why you're
really
so
get
important.
passionate
The
about
thing
it.
is that why you're so important. You are important for not for your own self. You're important for your family. You're important for your children as well, because you're a mother. You're a person.
Yes.
So that is the thing. And
Right.
thank you so much for your time. And I would like you to give the closing remark so that we just conclude this discussion. And thank you so much again for having us. Listening to your.
Yes, I'm happy to be here. Thank you for having me.